I mean, there's always barriers, right? It's always a new thing, and you have to learn the right buttons to click. It's very easy, but I think sometimes that's always a challenge. And I found that there's some patients that may not have enough Wi-Fi, so we get disconnected. It's not that frequent, but I think as time improves, technology will also improve. The other barriers, I think, from a physician standpoint are obviously reimbursement, right? And getting everyone to adopt that this is, and studies are rolling out that are showing, especially, we first started this really with acute stroke, so there's more data in that aspect as far as outcomes being similar and cost of care being better, that sort of stuff. I suspect it will be the same as we gather more information. And at first it wasn't, nobody was really reimbursing this, but we've seen a huge change over the same as we've seen this robust explosion of the use of virtual visits even within our own center. We've seen that more and more people are reimbursing. So I think with time that will be a barrier that's overcome. There are things that you have to be done in person, right? Like surgery, you're not going to do over the computer. So, and for us, I think the times often my patients, I'll do a virtual visit and I'll say, next time why don't you come in and we'll get an EEG, and then I'll see them in person. We sort of flip back and forth. And oftentimes people will schedule an in-person, and then when something comes up last minute, they'll flip it. So I haven't had, I'm a little bit cynical personally, so I was expecting more technological issues than we've had. Usually the connection is good, and if it's not, you can always just call and sort of flop it, so it has not been as big of a problem as I was sort of suspecting. Like when you get the new system, and you're waiting for the new update, waiting for the update that's good. It's actually been very good. I think from my experience, obviously, I would say absolutely. If you're not doing it or you haven't thought about it, haven't looked into it, you should. And I say that almost more from a patient. I really think it adds something to our ability to care for certain patient populations and take better care of them and see them more frequently and when they need to be seen. And I think we're doing them a disservice if we don't leverage technology to take better care of them. I think this is one way that there's a lot of downsides to technology, and this is one upside that we can really leverage to help people. And that's really why we did this study, was to look at it and sort of just share our experience, because we are a big epilepsy center. We have a lot of doctors, obviously. It's not just me seeing a lot of patients, and it's worked really well, and we've had a wonderful success, and the patients have loved it, and the providers have loved it. And so we sort of wanted to just share that as, to tell the community that, this is feasible. It's doable, and not only that, but it really helps patients, especially patients that aren't local.